So thanks, Wayne, for introducing me a bit. I work at the State Health Department in North Carolina in occupational environmental epidemiology, and then am funded by a federal program out of the Centers for Disease Control and Prevention with the Climate and Health Program there. And that's where we are. So I felt like I was coming to the West Coast, and maybe you all have been to North Carolina, but we're, in the southeast part of the state, and specifically the Arrow kind of places within a U.S. context, the communities we're working in. There's really diverse geography across the state, and I'll speak a little bit more about that community we're working in. So this is kind of the vision we have for the southeast part of the state, which is a place where people can, go outside, connect with their neighbors, exercise their pets in a way that is healthy and limits their exposure to air pollution. Currently, the part of the state we're in depends on prescribed burning, however, for a healthy ecosystem, for care for endangered species, for general land management, and is a part of a swath of the country where people are attempting to restore about 1 million acres of longleaf pine, which is an ecosystem that depends on regular fire, some research is suggesting annually. And within here, there's also some swamps, some pocasins, so there is areas that can burn that have peat in them, which is a slightly different sort of level, like set of pollutants. And this is part of the benefits of prescribed burning in this part of the state, which are pitcher plants, kind of a unique carnivorous plant, but there are sort of pollinators and plants and flowers that only exist in this area if there's regular burning. Resources that potentially humans can benefit from through recreation or other sort of ecosystem services. And many people have discussed, a primary sort of human health endpoint related to air pollution are asthma attacks. But also, people can see impacts on other respiratory and heart conditions. And so we are really in the business of trying to develop climate and health adaptations. That's kind of our work from the Centers for Disease Control funding. So we do that through this framework that's been given to us from the Centers for Disease Control and Prevention, which has us kind of anticipate climate impacts and assess vulnerabilities. So for that work, we have identified heat-related illness and kind of air pollution as primary areas of focus. And then within air pollution have come to focus a bit on wildland fire. And looking into the future, are these areas of concern that will likely increase with increased exposure from climate change. So we know there's going to be more hot days. Related to wildfire, we know there's going to be changes in precipitation patterns, changes in heat, and then like I mentioned, there's also these sort of outside forcers like ecosystem restoration that kind of play into that. And then assessing what the literature says about effective public health interventions. And then really what I'll talk about today is sort of developing and implementing a climate and health adaptation. And then I'll touch a little bit on we've begun to sort of quantify some evaluation. And so I was able to use Anna Rappold and her group had done a EPA vulnerability index around wildland fire, and were kind enough to share the data with us. And then we interacted specifically with some communities in the southeast part of the state to create a map that they wanted to look at. So we had actually gotten an example from the California Department of Health about kind of creating vulnerability maps, but then interacting with communities around how they wanted that map to look, what sort of knowledge they might have about their communities that could add to what we were measuring. So on the exposure side of it, the size of the green dot denotes the amount of exposure, and primarily from like sort of EPA modeled data for 2008 through 2012 where they removed sort of the expected particulate matter contributions from industry and transportation, assuming that what was left would be likely come from land burning. And then we also added in some North Carolina Forest Service data for the amount of acres burned and how many wildfires happened in that county. The sensitivity component came all from the EPA's work, and we didn't end up changing that with community feedback. But basically, a large component is pre-existing conditions from CDC data that are relevant to wildfire smoke exposure. Also, some socioeconomic status data is in there. I think there might be some age data for like certain age groups. And so the colors, red denotes the highest sensitivity. And then we also want to include some form of adaptive capacity. So how many people in those counties were accessing the AirNow information from the EPA. So hash marks denote low amounts of accessing that information. And so through that, we ended up focusing on Hoke County, the county in red. Between Hoke County and the county that borders it to the east in orange, there's about 20,000 acres that are burned annually. And a large amount of those are, about half of those are prescribed burns, about half of those are wildfires, some that come from the prescribed burns. And this land is largely owned by the second largest military base in the US. So they're burning for land management, they're burning to, in accordance with the Federal Endangered Species Act, and they're also burning sometimes just because of artillery. So I like to give the example of there's a butterfly that exists on the Fort Bragg bombing range. That's the only place in the world it exists, and that's in part because it's constantly on fire. And so every time I go down to Hoke County, I almost always see and smell smoke from the burning. So on assessing interventions, the interventions in the literature that sort of have the most published about them, which is sometimes not saying much because in the field of environmental health, there's kind of a paucity of data on what is effective in intervening and protecting people's health. But there's some on evacuation, on air filtration, on personal air masks, forecast systems, and public service announcements. And so these are all interventions that we sat with stakeholders and kind of created some criteria about, kind of ease of implementation, cost, several other parameters. And after that sort of discussion, the community all actually wanted to do something that wasn't from the literature, which was an elementary education campaign that would accompany some of the Smokey the Bear work that's done in elementary schools, which is largely kind of around don't play with matches, don't leave your campfire unprotected. And the framework we're given from the Centers for Disease Control and Prevention allows for this, given that, like I said, there's sometimes little research published about what's effective in reducing environmental health exposures. And then also kind of acknowledging that communities often might have the knowledge about what's going to be best to work in their community, and those things may or may not be published. So, for example, one of our key partners in this county has been managing the main fire department in that county for 30 years, so he has a lot of knowledge about how the community interacts with smoke. He helps answers phone calls from community citizens that are concerned about smoke. So what the Smokey Bear Elementary Education Partnership has looked like is we worked with the Hope County Foresters to develop 2 different games, one for an auditorium setting where it's like sentence game. So there's about like 10 different cards, each that has a different word on it, and you get student volunteers, and then the auditorium is kind of like coaching the students about where their signs should go in order for them to put together the right message about what to do when you see smoke. And then we came up with a bingo game for classrooms that's a little more involved, but for like a setting of 30 students where they're given a little talk about wildland fire and then try to match the different terms they may have heard about in the talk. And then we also developed some different asthma education tools for teachers and nurses, different printed materials. And for the evaluation component, we were able to develop a curriculum. 4 different county foresters received the training and the curriculum. And in the first year, so this is about from January through really May of 2019, the 4 different elementary schools have been reached across the county with about 1,600 students participating, largely in the auditorium settings, and about 50 teachers or school nurses received the asthma education and sat through the programming. And so here's a little bit about what maybe individuals can do, and some of this is a part of what we're doing, so I thought a little bit about like, what does it look like if this is effective? If a student understands that when they see wildfire, when they see smoke outside, and kind of our message to them, which I would love to receive feedback from anybody or comments about this, but kind of what we boiled it down to is, if you see smoke outside, tell an adult and go inside, which is problematic in some ways, because I don't know what their indoor air quality environment is, and I can't really measure whether that's better than what their outdoor environment might be like when they see or smell smoke. And then I also don't know what's going on. Like for example, is there somebody like chain smoking inside their house and they're going from outside into that? But our hope is that there would be more understanding in the community about, maybe if I had this activity at noon today, I should wait until I don't see as much smoke to do that activity. And Air Now is, still the main way people can receive public alerts in this area about air quality. And so here's just a summary of what we're doing for the climate and health adaptation, working with kids in a county that experiences a lot of wildland fire smoke exposure, teaching children in that county how to take protective actions. We are able to use GIS mapping in partnership with Untitled and their group at EPA to identify potentially vulnerable community. And, I think I haven't been able to talk to other people across the country that do Smokey Bear education, but this is done in maybe every county in the U.S., a lot of counties in the U.S. And so it'd be interesting to hear how other people work with foresters around this issue in the Smokey Bear curriculum. And this is the end goal, as hopefully an ecosystem that is managed well by fire. You can see that the longleaf pine habitat has been burned recently, and you have these kind of pretty views you get when the longleaf pine habitat is well taken care of, where you can see through the forest. We also have this person being able to enjoy the beauty of the forest and be outside and recreate without a lot of smoke exposure around them. So how do we make that possible? And just thank you to our partners at the EPA and my funders at the CDC. The U.S. Forest Service and North Carolina Forest Service have been very supportive of our work. The Hope County stakeholders have been very engaged. We have people from the schools, people from the health department, people from the county seat fire department, from the forestry service involved that all help us. And the Nature Conservancy has been a great partner. They manage a lot of land that's burned in the area. There's my contact information and the photo credits. And I think, yes, that's it.